Well, diabetes is a growing epidemic in Hawaii, affecting 155,000 people. 21 people are diagnosed in the state every day. So what are the different types of diabetes? What are the warning signs? And what can you do if you've been diagnosed? Dr. Kalani Brady with the John A. Burns School of Medicine joins us now with a look. Nice to see you again.
Good to see you, Christine.
Okay, so there's not just one type of diabetes. There's several types.
There are many types, of which 3 are the most common. The first is type 1 diabetes, which used to be called juvenile onset or insulin-dependent diabetes, but type 1 better describes it. That accounts for 8% of the population with diabetes. The second type is gestational diabetes, and that's in pregnant women. And risk factors include a family history of diabetes, excessive weight gain during diabetes, and a previous history of gestational diabetes in previous pregnancies. And finally, the big one, which accounts for more than 90% of all diabetics in Hawaii and the United States, which is type 2 diabetes, what used to be called adult onset diabetes, although nowadays type 2 diabetes can occur in teenagers. And it used to be called non-insulin dependent, and of course a lot of type 2 diabetes patients now are on insulin for treatment.
Okay, now we just saw a couple of the risk factors on the screen, obesity and family history. Can you talk more about that?
For type 2 diabetes, yes, obesity, we've seen an epidemic in Hawaii and in the United States in general. And of course, right along with that epidemic comes an epidemic of diabetes, type 2 diabetes. And family history, if you have a family history of diabetes, you are more likely to have type 2 diabetes.
Are there any signs for diabetes?
Early on, there are no signs, Christine.
No signs?
No signs at all. Later, you can have weight loss despite eating more and an increased hunger, especially a thirst and that you can't quench, trouble with vision, blurred vision, or light intolerance. There are many different signs. Difficulty healing infections is another one for type 2 diabetes, but most commonly it is no symptoms at all early on.
Wow. And what is the treatment?
The treatment basically is lifestyle modification, so that includes exercise, appropriate diet, and weight loss, and then turning to the doctor for medications that can help with diabetes. Now, the exercise and weight loss may eventually allow a patient not to have medication at all. But there are many different kinds of medications for type 2 diabetes, Christine, and you can add different types of medications that work in different parts of the body to combine them and effectively treat type 2 diabetes.
And what can you tell your family if you find out that you have diabetes?
Well, first of all, you should tell your family. Family history is a risk, so they need to know that you have it because that increases their risk. But also, in taking care of your diabetes, you provide a good example to the children in your family what not to eat, what to eat, and how to keep their weight down.
Okay. All right, and next week? Next Thursday, what's coming up?
Next week, we're going to talk about cholesterol.
Cholesterol, that's another one that
a major risk factor for heart disease as well.
All right, thank you so much. And diabetes, again, unfortunately, very common here in Hawaii.
Yes,
all right.
4 out of 9, almost half the population either has pre-diabetes or diabetes in Hawaii.
All right, well, thank you for your tips.
My pleasure.